Well, it's been a great show, and we're going to talk about giving to the veterans who gave so much to us. We're going to welcome Dr. Jorge Garcia from Apex Skin. Great to see you again.
Thank you very much.
I always get a kick out of seeing you because I always flash back to one of those first pictures I saw of you, and you were sitting in an aircraft. So what was your life like in those days? What was that about?
Yeah, back in the day, I had the privilege of being a flight surgeon for a Marine F-18 squadron. So it's really like Top Gun type of life.
Yeah.
So, my job was really, take care of the Marines in the clinic, but also, take care of the aviators and making sure they're healthy to fly.
There it is. There's the picture. That's quite a flashback.
That's awesome. Yeah.
Who's the guy with the hair?
I know, that's me, brother. I look good.
You look good, man. You look great. That was a great time in life, but you have some great things going on right now. We want to talk about the Purple Heart Project.
Yes, listen, I wanted to create something that was special, that can blend my passion for dermatology, but also for my military service. So we, a few years ago, we created the Apex Purple Heart Project, which is really a way for us to give back to our veterans. It's a way of, we provide complimentary scar revision for wounded veterans. So it's a great way for us to kind of, pay back to the vets, but at the same time, getting back into the game. Because as you know, sometimes scars go a little deeper than the skin.
Yeah, right. I mean, you're self-conscious about it, or there's also all the worry about, you get a little spot on your skin. People are worried about that. And, you're talking about veterans. I mean, go back to the Vietnam War veterans. I mean, they're the perfect age right now who went through a lot of skin problems. Back in the day, those guys, us, that age, we didn't know what sunscreen was.
Yeah, we do a lot of patient education, also, throughout this month for what to look for in the skin. If you had a new spot, if something is bleeding or crusting, you get it checked. In fact, this is a prime time for people at the end of the year to get checked because people want to get a deductible is met and everybody wants to get in to see their dermatology clinic.
And the great thing about Apex is you can actually get in to see a doctor when you need to see a doctor. I mean,
yes.
A lot of times you try to get into a system and it's difficult, but you have so many locations now.
Yeah, we have 12 locations. We always have same-day appointments or next-day appointments. That's really kind of one of our value propositions. And we're also, I wanted to tell you, we're also kind of we're breaking down barriers for dermatology. We now have a new clinical trial center where patients that if you're not getting better with the medication or if your medication is not being covered by insurance, we have now clinical trials that are really helping patients get better, and it's free of charge. So I encourage you patients to go to our website and read about them because it's terrific.
We talked to Dr. Mark a lot, and he talks about when he became a heart surgeon, how what he learned in school and as he practiced in the beginning doesn't even pertain to what's going on right now. Things have changed so much. Is it the same way with dermatology?
Yeah, things continue to evolve. There's new medications, there's state-of-the-art treatment for things. Talk about the scarring, we have tons of new treatments for scars that really kind of help you get back into the game. That's why I think it's so important for people to, hey, if you get a new spot, go see a dermatologist. If you get something that you want to take care of yourself to make you feel better, don't be, we have tons of new treatments and we can help you. And a lot of stuff is not surgical, so it's very easy on the patient and, gets you back into the game. That's why we say at Apex, transforming life through healthy skin.
Yeah.
We really believe on that. Come see us and we'll get you back into the game.
So going back to the Purple Heart Project, how do people get involved? They just make a call the office or just call Apex? What should they expect?
We have a very straightforward, streamlined application through the website, apexskin.com. It kind of follow the instructions there. We kind of have a questionnaire to make sure that you're a veteran, make sure that it's legit, a request, and then we have quarterly we review this request, and then we kind of select you and we'll call people and we get the treatments going. Sometimes the laser, sometimes they're microneedling, depending on what it is.
And how often should people come to see you once they see you the first time?
For scars, it depends, but I do think that, personalized treatment. Some people need 1 treatment, some people need 4, but in general, once a year, get a skin check. That's what we recommend.
Dr. Garcia, take care of you. Apex Skin, right?
Yeah, apexskin.com. Thank you.
A whole bunch of locations, so check it out. Okay.